So I just walked into the pharmacy, to buy some drugs. So on the counter, I saw some leaflets. I just saw prostate cancer, screening, surgery and all whatnot. So then I just called one of the numbers on the leaflets. But I've never had the opportunity of going for prostate screening. So I think this is a very big opportunity for me. I said I wouldn't miss it.
50-year-old Noel is at this health facility for a free health screening. Like him, thousands of Lagosians eagerly wait for free or subsidized health missions by government or private institutions.
If you go to an hospital, it takes you a lot of time. But as we come here today, I can see that things were very fast. And I can see the treatment, the doctors, the way they are attending to people, and the drugs they gave to us, because we've been going to hospital, we've been seeing what we have been given, and we saw that there's no difference. So I'm very, very impressed. And I think this program will continue.
The National Health Insurance Scheme, Decree 35 of the 1999 Constitution, states that every Nigerian must have access to improved healthcare facilities. Taking a census of access to the public hospitals, the reverse is the case, as the vacuum is felt in most states. However, access to services is just one dimension of universal health coverage. How much people pay for the services is another.
And since February, I've been on dialysis 2 times a week because I couldn't afford the times of 3 times a week.
The money is not so much an issue because compared to private hospitals, government hospitals are a lot cheaper.
Most of the service there is not encouraging. If you get there before they attend to you is a problem. The way the nurses will harass you, the way they will attend to you is not welcoming. Even the attendants is not something to talk about.
Lagos population is about 21 million, with less than 30 general hospitals and over 40 primary health centers. No doubt, the growing population increases the demand for more health facilities.
General consensus is that lack of finance was not only the barrier in accessing health care. Many people that have the money hardly get health care as at when due.
Medical doctors who own these private hospitals work in the general hospitals. So in that light, it actually means that you're actually just wasting your time going to the private place, because the only difference is probably in some of those private hospitals they have some machineries or machines which they don't have in a private or government hospital, on the public hospital. But I think it's getting better now, because really if the human resource to handle the machine is actually working in the public hospital, what is the essence if you go to a private hospital, you don't meet a gynecologist, they will tell you it comes only on a Tuesday or a Thursday. It doesn't make sense.
They have phobia of going to the hospital. Many people, if you talk to them that you are sick, go to the hospital, they say I don't want to go to the hospital because of the way that nurse will harass me.
Health center tẹ́mi ń lò ní Ìṣẹ́rí ọ̀nà gọ́dọ̀ wọ́n attend sí mi dáadáa wọ́n dẹ̀ ń dá mi ló kódà ìyàwó mi tó bá lọ sí clinic yàtọ̀ sí pé kó gba card wọ́n gba owó lọ́wọ́ ẹ̀ wọ́n dẹ̀ gbẹ́ nìtì lọ́wọ́ ẹ̀ tá a bá ti débẹ̀ wọ́n máa attend sí wa dáadáa.
One state keen on setting the pace in the area of improved health care is Lagos State. Before now, the state free health policy was in place, but it lost its steam.
The free health policy was established by past governments as a way of addressing that financial protection to the poor. We also do know that the free health policy did not work, did not achieve its aim. Nothing is free. One reason is that the budgeted provision to the health sector is totally inadequate. There is no way you can fund anything health free without the huge resources. If you trace the the health budgets in any state government, even a federal government over the years, you find it's totally inadequate. At the federal level, if you look at the health budget compared to the total national budget, it's less than 5%. Meanwhile, WHO, all of them are talking about 15% minimum. So let us assume that 15% is correct, 5%, 50%, that's not very, very little you can do. The same thing we have tracked in Lagos State for over the years now. Our budget for health has been increasing. But if you break down the budget to capital, recurrent, and personnel, you find that now you needed to take a decision in particular. Do you make it free? You're going to make it free. Okay, you told people are free. They don't have where to go to. They don't have a proper hospital. They don't have anything. So which is the egg? Which was the chicken?
And to the glory of God and the betterment of humanity.
Taking a step further to ensure healthcare remains paramount through its inclusive healthcare policy, the Governor Akinwunmi Ambode-led administration is setting the pace with the Lagos State Health Insurance Scheme.
In furtherance of government's effort to strengthen the health facilities in the state, the Bola Tinubu Health and Diagnosis Center will soon become operational again. The rehabilitation and upgrading of the 247 bed and 5 theater suites of pregnant women, popularly called our care house, is ongoing and should be ready for use by June 2017. In addition, approval has been granted for the rehabilitation, upgrade, and bulk purchase of medical equipment required in 20 secondary and 21 primary health facilities across the state.
Over the years, again, we try to now build up capacity, infrastructure at the health sector, because we made a conscious effort to increase the capital proportion of that budget. So the budget is totally inadequate. We have a huge population in the state to cater for. And so it stands to reason that we must look for other sources of funding the health sector. In any normal country, without a financing scheme, it's wasting its time. And that's why we feel that a health insurance scheme is essential. And now, people have been talking of universal health coverage. That universal health coverage means certain things. One, we must protect the poor. We must improve access. We must ensure quality of care. We must ensure comprehensive care. If you are going to do this, and the essence is that you have to de-emphasize free health. That's why we're going through this. So the health insurance to cater for all of this. So to answer your question, once this insurance starts, free health policy is needed because it's subsumed under that.
No doubt, the scheme will limit the rise in the cost of healthcare services. One question that comes to mind is ensuring equitable distribution of healthcare costs among different income groups.
I would say management. I would say we need more directed management. And then also enrollment. A lot of people don't know that they are eligible. A lot of people don't know how to even enroll in the national insurance scheme. So we need some effort in preparing people's minds, getting them ready for enrollment, and maybe electronics, allowing people to register online, making it easily accessible, and doing some tutorials would go a long way.
What the law says, the law does not differentiate whether you are Yoruba or Hausa. If you are a resident in Lagos, it is compulsory for you that you must register in this scheme. You see, when we started the preparation, part of the thing that's actually making it long for us to implement now is the IT platform. When we first started, we did the actuarial studies. You needed to do a study that's done by experts to give us an idea of how much it will cost us to implement this thing, how much people have to pay. When they came, and again, one of the problems again in this country is that data is not readily available. So even from what they gave to us, they recommended 70,000 naira per family of 6. But we presented all this and we gave government 3 scenarios, 70,000 naira, 50,000 naira, 40,000 naira. Because it's a new thing, because of the context of the poor people, the government chose 40,000 to start with. So the premium is 40,000 naira for a family of 6. That is a father, mother, and 4 children. Now, that's the figure that group. Now, if they have more than 6, there are provisions for individual subscription, but those are going to be slightly higher because now the risk now is not being shared. You understand me? And that one again now, what we are trying to make it very easy for people to pay. So there are going to be different platforms. We are exploring the different platforms, whether people use cards, people use POS, people use scratch cards, people use bank cards, all those. We are exploring those people, we are talking with people so that we make it easier for people to pay.
With the scheme, the Ministry of Health is also putting machinery in place to ensure a high standard of healthcare delivery services within the platform is maintained.
Public and private facilities, and the reason being that we need to increase access, or people must have increased access to care. Now, but again, as a provider, whether public or private, there are standard requirements because, like I said, one of the essence is to ensure quality of care. So, any provider who is going to be empaneled on this scheme is going to scale 2 levels of requirements. One, the provider must be accredited by HEFAMA, that's a Health Facility Monitoring Accreditation Agency. And for them to be accredited, they have to fulfill certain criteria, which they will inspect, which they will check. The essence is that we want to be sure that the facilities have the wherewithal to provide the services, quality services expected in terms of staff, in terms of equipment, in terms of so many cleanliness, provision of drugs, etc. That's all. Once they scale that, the farmer tells the agency that, okay, this facility A has satisfied us, can be empaneled. Now the next set of requirements will be set aside. Based on that now is what they use now to record them. And one of those is also to ensure quality of care. The people who work in that facility must be indemnified. They must be insured for malpractice. Because now people are paying from their pocket, they have every reason to ensure that they get service for this. In terms of quality, we said every key personnel in that place must be BLS, as a basic life support certified. That's if you have an emergency, you can restore life, you can maintain life quickly. People must be trained. That is what happens all over the city. That's part of it. Each facility must have a BVN number because we're going to pay the facility. We want to be able to track the payment.
The Lagos State government, apparently they are always in the forefront of anything progressive. Healthcare is tough anywhere in the world. You know, it's even UK is struggling with it. It's expensive. I spent 7 years in Canada as a doctor, and it was a struggle. The US, you can see, part of why Clinton was so disliked by physicians is because of what she tried to do in healthcare. It's about 1/6 or 1/7 of the entire economy of the US. So it's very difficult. Lagos State, I trust, will do a good job. The first thing is to have a good census. You have to know who you are going to care for, since it's expensive. Because as soon as you start, everybody will come from Niger Republic, from everywhere everybody will become a Lagosian. So you have to good census, good monitoring system. And then to sustain it, you have to prevent abuse. Because you don't know what provider, who is the provider. You may find somebody just open a little shack somewhere and just be sending you bills. So you have to have a good monitoring system. And when you visit them, somebody is charging you for CT scanner and he doesn't even have X-ray machine. So you need to know, you have to have all these checks and balances. And then the providers must be up to snuff, as they say, in knowledge and experience. Because if you don't make the correct diagnosis the first time, you still charge. So you charge 10 naira and you miss the diagnosis. Another doctor will charge 10 naira to get it, that's 20. So you need a doctor who can make correct diagnosis first time. So you pay just 10 naira. Those are some of the major points. But it's going to be tough because it's very laudable project, but it's hard to sustain.
Some of them try to direct your medical practice based on financial gains. Let me put it that way. For example, some of them will tell you which tests you can run, which tests you cannot run, not knowing that the way to make money is not by restricting the doctor's ability to do some needed diagnostic tests, because like we mentioned earlier, prevention, you'll spend, there's a research that shows that if you spend $1 or say 1 naira now, you can save $10 or 10 naira later. So if you allow us to focus on some of these diagnostic tests, you'll end up avoiding some surgeries, some costly drugs, some other things down the line.
Allocate enough funds and make sure that these funds are judiciously and properly used. I think that is it. I think the framework is good. The plan of action is good. I commend them for that. And I think more and more states should adopt that.
Basically, insurance health scheme is good. Life insurance, all those things, they are good. Anything that has to do with insurance, I believe in it. I like it. And I believe when I'm worth it, I would definitely venture into it.
It talks about the total securement of the life of human being, mostly on this side of our continent here, Africa, Nigeria. We really need that type of scheme.
I think what it's all about is like trying to provide a form of finance in such a way that in case you have probably some kind of terminal illness or some kind of things, the insurance is supposed to be able to cover for it at that particular time, especially when you don't have money.